good evening. I'm a nursing student at Southern Technical College, and my name is Rosa Heffron, and I'm going to give a speech on how to draw blood step by step. So the first step that you want to go ahead and do is you want to review the doctor's order with the patient, okay, and make sure that you have the correct patient that is sitting on your chair. You want to have two identifiers, which will be the first and last name of that patient compared to the order, and then you want to make sure that you have their date of birth, okay? So the first step that we're going to be reviewing is you want to talk to that patient with confidence. And why do I say confidence? Because a lot of patients are very nervous when they're going to get their blood drawn. Some patients have fear to needles. Some patients pass out. So you want to make sure that you just don't go into that room and be like, oh yeah, by the way, I'm going to just stick a needle in your hand. So we want to go ahead and make sure that you have confidence. So the second step that we're going to be doing is applying a tourniquet. You're going to go ahead and tie a tourniquet in their arm, so that way you can see the site, the vein that you're going to go ahead and draw blood from, okay? So you're going to make sure you're going to explain the procedure, that the rubber band's going to be tight around their arm, okay? And if you're going to be using the right hand side and you don't see anything, go ahead and remove the tourniquet and put it in the left hand side until you find a good vein, okay? You don't want to just go ahead and be stabbing the patient everywhere, okay? You want to make sure that you find the correct vein. So once we have found the correct vein, we're going to look for the correct size of needle, okay? So that way we make sure that we won't damage the blood vessel, okay? And that way we can access whatever amount of tubes that the order requires. So the fourth step is we're going to clean the site with alcohol, okay? And then puncture the vein with confidence. Grasp the patient arm firmly using your thumb to draw the skin taut and anchor the vein. The needle should form a 15 to 30 degree angle with the surface of the arm. Confidently insert the needle through the skin and into the lumen of the vein. So you want to go ahead, let's say, for example, this is the needle. You want to make sure you go like this, you know. You're not going to stab into the vein. You're going to do a 15 to 30 degree angle. So the fifth step, we're going to be changing the tubes, okay? Once we finish changing the tubes, we're going to go ahead and remove the tourniquet. Never leave the tourniquet before you remove the needle, because then you're going to have the blood squirting at you, and you don't want to have that. So after that, place a gauze and piece of paper tape, whatever you have. If you have one of those special bandages, you know, and you need to add pressure to that site. So that way, you know, and you always want to ask the patient if they're taking any blood thinners, because if you don't add pressure, the patient's gonna walk out of the room, and then you're gonna have a bloody mess everywhere. So you want to make sure that you ask the patient always if they're in blood thinners, okay? So and something else that we want to make sure is that you follow all the steps correctly. And then the final step after removing the needle is, you know, carefully change after changing each tube and removing the tourniquet. So this is the way that we're going to go ahead and draw blood. So thank you for watching.